Great. We've got some wonderful people with us today. Thank you, everybody, for joining us. I hope everybody has had a great day with some great sessions and some breakouts. We are going to go ahead and kick things off here. I have Lee Hall with us, coming to us with Drug Co. Going to be addressing some great topics with us today. Just wanted to go ahead and
Aaron, I think you're on mute, man. We kind of lost you there.
Oh, goodness. Somebody put me on mute. Okay. So rules of engagement here. Please put your microphones on mute for the time being. As Lee goes through his presentation, he has asked that he'll give us some opportunities to voice any questions as he goes through his presentation. So we will handle those organically. I'll be monitoring that in the chat, but also if you wanted to raise your hand or unmute yourself at that point, feel free to do so. But until then, please go ahead and keep yourselves muted. But please turn on your videos. We love to see your beautiful faces and see you engaging and seeing if Lee's actually putting anybody to sleep, which I doubt he'll do. He's got some great topics.
I try not to. I try not to.
But it's a good way to read your audience. So, so please go ahead, turn your videos on. And then at the end of his presentation, we are going to be going through some trivia for his giveaway. And so pay attention, engage in this session, and then we'll go over the rules of the trivia at the end of this session, but he will not actually be giving anything out at the end of this session. We'll just be doing the trivia. We'll tabulate everything, and then they will actually be posted on Drug Co's splash page tomorrow. So just keep that in mind. We will not be announcing any winners of the trivia giveaway today. It will be tomorrow, but stay tuned until the end of this presentation so that way you can participate in that. But with that said, I will go ahead and turn things over to Lee for a great presentation that he has from Drug Co.
Thanks so much, Aaron. I really appreciate your assistance today with this presentation. And I want to welcome everybody to Hope's educational session this afternoon, the Pros of Prophy. Before I switch over to presentation mode, which, did I just lose everybody? There we go. Before I switch over to the presentation mode, I just kind of want to show you some of the giveaways that may be in our booth that would go out to anybody that drops by the Drug Co page. We have some hand sanitizer. It's kind of cool in the little pin style. It's spray, so you can kind of keep everything sanitized, especially in this day and age of COVID where we want to wash our hands regularly. But I love keeping this in my factor travel kit. So when I travel abroad or when I travel anywhere, if I ever start to travel again, I always make sure I carry this with me in case I'm not close to soap and water. Also, one of the giveaways that we've got are these neat little Drug Co masks. So any of you that are still managing to wear a mask in public spaces, we'll have some of these. And then we've also got some pins that we're giving away. So those are some of the items that you would receive if you go by and just register at the Drug Co page. But now I'm going to switch over and tell you a little bit more about the presentation today. Okay.
Hi, Lee.
Hello. Okay, let me share this screen.
Mira, mami.
All right.
Renee, can you mute yourself? Thanks, buddy.
Thanks, buddy.
Let's see if we can get PowerPoint pulled up right there. Okay, can everyone see the slide that's up? Drug Co-Health, the Pros of Prophy?
Yeah, Lee, you're good.
Yeah, Lee, you're good.
Looks good. Looks good.
All right, great. Well, some of you may have seen this presentation back a few months ago for the Hope Prophy Conference, but I've got some updates to it, and it's kind of evolved a little bit based on some new information. So I want to kind of share some of that info with you today. For those of you that don't know me, my name is Lee Hall. I have severe hemophilia A, and in my family, it's pretty much a family affair. We've been able to trace my hemophilia mutation and family history back to 1608 in Arnhem in the Netherlands. So it's kind of cool that I actually have my family tree going all the way back to Europe during that time, where my hemophilia mutation originated. I currently work at Drug Co-Health and have been there for the last 3 years. I've worked in the infusion therapy, biotech, and nonprofit arenas my entire life in hemophilia. Nonprofits have been my love and my passion. Growing up in the bleeding disorder community, I started volunteering at a really young age, and camps became very important to me. I want you all to know I'm not a clinician, nor in any way, shape, form, or fashion am I promoting any specific type of clinical care. And I highly recommend each and every one of you to establish a relationship with your clinical team and take any questions you have to that clinical team that supports you and your care, because they're going to be able to help you make those best decisions. But as I was saying, this really is a family affair. This is a photo of me with my mom, my dad, my brother, and my aunt. Everyone in the photo has been very active in camps and in the chapters throughout my entire life. My younger brother actually has severe hemophilia. Some of you may know him. His name's Jonathan. And then my mother and my aunt are both women that are carriers, but they also have lower factor levels and have experienced bleeding episodes. So we've had to do a lot of advocacy within my own family for my own family members to get the proper care they needed. Now, as Aaron was saying, we're going to have some giveaways. And one of the things we really want to encourage everybody is to go to the Hope exhibitors webpage and go to the Drug Co landing page and register. For those individuals that have registered, we will draw one name out of everyone that registers by the end of the exhibitors tomorrow, and one person will win a JLB speaker, that waterproof speaker that's a Bluetooth connectivity, and it's a really great little sound device. But we'll be giving away one of those in addition to some of those swag items that I showed you earlier. And then today, good, go right in there and register. You'll put your name right in that bucket. But throughout this presentation, pay attention to the material that I'm going to share with you, because we're going to have a trivia game. And 2 people that get the top scores from the trivia game will actually win a $50 Amazon gift card. Everyone that registers at our webpage will actually, will actually be registered to get some item, and hopefully we'll be really excited to send out that speaker and a couple of those gift cards to you guys. So today in our presentation, we're going to talk a little bit about the advancements in bleeding disorder timeline. We've had a lot of things that have happened over the last 5 or 6 decades, really, that have revolutionized the clinical care. And we're going to talk about that a little bit. We're going to talk about conversations surrounding prophy and the importance of FDA indications and prophylactic therapy. We're going to talk a little bit about physical and mental health benefits. This month, May, is Mental Health Awareness Month, and 1 in 4 people actually will be diagnosed with a mental disorder this year. And so that's a large number. And in the bleeding disorder community, we have a lot of people that suffer from anxiety, depression, ADHD, and other disorders. And comorbidities such as hemophilia, HIV, HCV, and joint disease actually compound mental health challenges and issues. So we'll talk a little bit about that. And we'll talk about bleeding logs and prophy logs and those things that you need to do to create reminders and patterns for you to actually adhere to your prophylactic schedule, but also the importance of them because of new regulations and changes. And then I always want to encourage everyone to have honest and real and truthful conversations with your clinical care team. At the end of this presentation, you should be able to have a meaningful conversation with your clinical team, your family members, and your fellow blood brothers and blood sisters about the benefits of prophy and what you can do to help empower your life. So I really loved putting this presentation together because when you look back, there are some really neat advancements that we don't often hear of in our community. In 1828, the word hemophilia was first used to describe hereditary bleeding disorder, and it was recorded in a publication by Hoff in Zurich, Switzerland. So just think, you know, 200 years ago, roughly, or just under 200 years ago, is when the word hemophilia was first used. Now, we do know that in other literature, other documentation, and going back into Jewish texts, that there were descriptions of bleeding disorders that were recognized, but we never had the name hemophilia to use as a label for a hereditary bleeding condition until 1828. Queen Victoria had the longest reign of any monarch in the world until Queen Elizabeth II. And Queen Victoria passed along the hemophilia B gene to her daughters, who spread the hemophilia B gene throughout Europe's royal families. And she had one son, Leopold, who actually had severe hemophilia B. Because of Queen Victoria's connection with hemophilia, the disease became known as the royal disease. Now, back in the 1800s, we didn't know if it was hemophilia A or hemophilia B. We just knew it was a genetic bleeding disorder of some sort at that time. Now, Eric von Willebrand in 1929 identified a bleeding disorder, and he named it after himself, von Willebrand disease. And so that was a protein that they identified at that point and started doing some research. In 1947, Dr. Alfredo Pavlovsky demonstrated whole blood infusions could be used from one person to another to treat people with hemophilia. And so if he had a patient that had the same blood type that did not have hemophilia, he could use that to transfuse that person with hemophilia. So in 1947, they started using whole blood as a method to treat hemophilia. Now, 1952 doesn't seem too long ago. My parents are just a few years older than that. And Stephen Christmas was the first patient ever identified with hemophilia B or factor IX deficiency, and they named it after him, Christmas disease. Aaron, does anyone have any questions surrounding these? All right, we'll go to the next.
You're be good there.
All right, we'll head on to our next slides. Now, in 1959, Judith Graham Poole and Gene Robinson developed the two-stage factor assay. Now, it's really exciting because a lot of you have probably heard Judith Graham Poole's name mentioned. She's she's recognized as one of the leading scientists that really advanced hemophilia care. And during the 1960s, they were using cryoprecipitate to actually treat patients with hemophilia. And many of you may know family members, or maybe you even yourself have utilized cryoprecipitate. In the 80s, when I was hospitalized experiencing some bleeding complications, we knew I had factor VIII deficiency and I had been on clotting factor VIII, but because of the complications that I had with my bleeding condition, they gave me cryoprecipitate, and it's a very painful process because you're using bags of very cold cryo that is in sub temperatures that really send a bone chill throughout your body, and it can be very problematic, and it's not always effective for long-term use and in resolving a bleeding episode, but it would help somewhat, and in some cases it would get those bleeds under control. But in 1964, Judith Graham Poole was taking a look at a bag of plasma, and as she was scraping out the residue in that slushy bag, what was clear and just kind of slushy and slimy, she put it under a microscope and she realized that it was rich with factor VIII. And at that point, through her research, that led to the development of fractionation processing that increased manufacturing to where commercial products were able to be created and produced and marketed on a commercial level to the population across the US and around the globe. This did not really become commercially available until 1970. So when you think that, you know, just 50 years ago, 51 years ago was really when factor VIII started to emerge onto the market. And in 1970, that's when doctors first started talking about prophylaxis as the standard of care and what was needed. But as they talked about prophylaxis and the prevention of bleeds instead of the reaction of active bleeding, this treatment modality was not widely embraced. Now, in 1978, the first factor product for hemophilia A and von Willebrand's disease was approved, and that was alphanate. And in 1980, Alpha-9 was approved by the FDA as the first factor IX concentrate manufactured by Grifols. The slide that I just brought up is with me and Dr. Bruce Evett, and I wanted to include that photo in this presentation because in the early 80s, Dr. Bruce Evett was head of the CDC, and he reported a suspicious infection in the blood supply to the federal government and to the FDA multiple times over the course of the year. And in 1982, HIV positive patients were identified in the hemophilia community by the CDC. And many of you recognize the term hemophilia holocaust. We've lost many of our blood brothers and blood sisters and family members to HIV and the complications thereof. And that man, Dr. Bruce Evett, was really the physician, clinician, and advocate for our community that really tried to help protect us and advocate for us and notify the government of what was really happening in the blood supply. In 1985, the first antibody test for HIV became available. And in 1992, the first recombinant factor VIII product was approved by the FDA. So literally a decade after HIV was spotted in the blood supply, it took it 10 years, it took an entire decade to come up with a recombinant technology product that was safe for the community to use. Now, up to this point, nowhere amongst any of our clinicians, amongst any of our treatment centers, were we learning about prophylaxis on a regular basis. It might be whispered in the community here or there, but it didn't become a common word and a common terminology until 1995. And that is when prophylactic therapy really started to emerge and when that started to grow that movement. In 1997, the first factor IX product was approved by the FDA, and that was Benefits. Now, none of the products prior to this time were ever licensed or recommended for prophy infusions. They were actually for use for on-demand treatment of active bleeds or perioperative management, that management of bleeding within the emergency room or surgical setting. Cogenate was the first factor VIII product to be approved by the FDA for a prophylactic indication, and that did not occur until the year 2008. I did skip right over the 1997 advancement of Novo-7 was the first bypass agent approved by the FDA for the treatment of inhibitors. So just in the last 20 or 30 years, we've really seen some clinical advancements and some indications within therapies that have reinforced the ability for us to effectively utilize prophy as a method of treatment. And the research that the manufacturers have, the research that they have done, testing their products on prophylactic management in conjunction with our treatment centers, the FDA, the CDC, and our national and local agencies has been amazing because it's really given us an insight as to how beneficial prophylaxis really is for the body. In 2014, Eloctate and Alprolix became the first two long-acting hemophilia concentrates to be approved by the FDA with indications for prophylaxis. And I think one of the amazing things about this launch, and I have to say I had the honor of being on that team to launch both Eloctate and Alprolix, but it was mind-boggling to me that the factor IX community did not have a prophylactic indication until 2014. Now, one of the complications of not having an indication in those earlier years was the insurance company would not pay for it. The insurance company would deny claims or not pay for factor replacement unless it was an on-demand or active bleed or for perioperative management. So the fact that in 2014, that really was expanded and both of those products had that indication, and every product since 2014 has come out with a prophylactic indication, if I'm not mistaken. In 2019, hemophilia gene therapy companies all rushed to submit information on clinical trial data to the FDA, and they're looking at readouts on these clinical trials, hopefully later this year or hopefully possibly in early 2022. Are there any questions at this point, Aaron?
Let me take a look. Let me take a look. Chat. We're good to go. We're good to go. Can you hear me, Lee? Can you hear me, Lee?
I can hear.
Okay. Yeah, I think we're still good to proceed.
Lee, if you're talking, we cannot hear you, bud.
We may have lost Lee.
Lee, you there? We can still see your screen, but we cannot hear you.
Anybody have leftovers from last night's dinner? That was an awesome session, by the way.
Yes, and I'm eating those for dinner. Or eating that for dinner tonight.
Yeah, me too.
The caprese salad did not make it past breakfast this morning.
Yeah, they left me only one.
Well, hopefully Lee can get reconnected here. I really love this presentation because I myself only recently converted to Prophy 4 or 5 years ago. Life changing.
I'm friends with Lee, so I just sent him a text message.
Thank you so much. Here we go. Here Lee's coming back.
Hey guys, can you hear me?
Hey, there we go. Welcome back, Lee.
Sorry, I think I lost you guys, or you guys lost me rather.
Awesome. Welcome back,
Am I
Lee.
good now?
Yeah, go ahead and continue.
Gotcha. Okay. Let me start sharing the screen again. Sorry about
Thank
that.
you.
We will continue. Technology has never been my favorite thing. Okay. Okay. Can everyone see the screen now? The Prophy for youth, adolescents, adults, including men and women.
Yeah, we're good.
Good job.
Can you guys hear me?
Yep. Go ahead
Yeah,
and
you're
continue.
good. Oh no.
Uh-oh, Lee, are we having
Hello?
connection issues again?
Wait, here we go.
Okay.
Can you hear me now?
Yes, we can hear you. And we
Yes.
can see your
Sorry.
screen.
Okay, great. Sorry about this, guys. I really apologize. So the Prophy for youth, adolescents, and adults is really kind of an important topic, especially when we're talking about indications, because as we were talking about before, prophylaxis was not an indicated usage for hemophilia A and hemophilia B until the year 2014, and that was with those long-acting factors. Now, prior to that, no factor IX product had that prophy indication. And now they do. And so every manufacturer is doing these expanded clinical research trials on prophylaxis for youth, adolescents, adults, and even women in some cases, which is really exciting for me, because when you utilize prophylaxis in the appropriate manner, you're going to reduce active bleeds. You're going to reduce those muscle bleeds, those tissue bleeds, those bruises, microbleeds, things that wear on you on a regular basis, and you don't even realize how bad your body hurts until you actually adhere to your prophy schedule and you feel much better. It'll allow children to live a more active life. And for women who get on a prophylactic regimen, when they have a bleeding disorder, it can be life-changing because it can reduce their menorrhagia symptoms from, in some cases, 20, 21, 25, 28 days down to a regular cycle of just a few days. And so this increases a person's quality of life. And with women, it'll help prevent them from being anemic and many other complications. But when prophy is followed appropriately, it will open doors to a more fulfilling life, to where you can actually do the things that you and your family really want to do. Physical therapy and other activities to support your bleeding disorder and to help your body grow are really important. A lot of patients, once they are on prophylaxis, will work hand in hand with their hemophilia treatment center and their providers, their clinicians, to find out really what prophy schedule they should be on in order to adhere to that physical recommendation of that sporting activity or that game or that program that they may want to do. I always love those high adventure, fun, adrenaline seeking things, but I started working with yoga many years ago. Betsy Case was a yoga instructor, and she worked at the National Hemophilia Foundation in Handy, and she started creating yoga programs for people with bleeding disorders. And about 25 years ago, she was the first person who ever taught me anything about yoga. And since then, I've gone on to practice Pilates on a regular basis and go and seek out acupuncture for issues with my pain and my joint mobility issues. And that has worked really well for me. But along the way, as I chose some of these activities, as you can see, I'm swinging and hanging from the Cadillac on the Pilates machines. These are not activities I recommend for everyone with a bleeding disorder. I had limited mobility in my elbow and in my ankles, and I found these activities helped reduce pain and helped increase my mobility and my strength. And as I was exploring new things, I was communicating this with my hematologist and my physical therapist. And I was sending my physical therapist photos of me regularly. And what I really have loved doing is having effective conversations with these clinical partners, because once you have honest communication with these clinical partners about what your passion is, whether it's playing football or basketball or soccer or mountain climbing or kayaking or swimming, whatever it may be, you can have an honest conversation with them and they will help give you the best clinical advice they can. And this will help strengthen you and also give you those positive endorphins that will help you with your own mental health. Now, the issues that we see and experience with prophylactic therapy is, people metabolize factor at a different rate. A lot of people that are experiencing problems have issues because they don't know what their actual weight is. And that dosage, they don't know how to calculate it correctly, or they've been misdosed, or children that are going through puberty, as they grow, their factor needs to increase in order for them to be covered effectively. So most breakthrough bleeds occur because of the failed therapy has happened because patients aren't being compliant and they just aren't taking it as prescribed, or they're taking the incorrect dose because of their weight, or they just aren't having honest conversations about their activities with their clinical providers. So all of these things create a complication surrounding compliance and preventing those bleeds. Now, one thing that's happened this year is insurance companies are starting to be very, very stringent on the documentation that they want. Changes in authorizations and duration to receive those authorizations is increasing. So when you order your medications, your specialty pharmacy has to get a prior authorization from your insurance company. Those authorizations, once upon a time, would be given on an annual basis. Now, many of the insurance companies are requiring each shipment to have a separate authorization, and that authorization can take up to 2 weeks to get approval for your specialty pharmacy to ship medication. In addition to that, the insurance companies are saying, we want documentation of all of the factor logs for the patients that are on their insurance program. And so the specialty pharmacy is having to submit that documentation, not only to the clinician, the hemophilia treatment center or hematologist servicing you, but also to the insurance company to make sure you don't have a lapse in coverage. But it goes back to your responsibility, because patients have to fill out those bleed logs and notify their specialty pharmacy and their clinicians when they're having breakthrough bleeds, and notifying them about the prophylactic regimens that they are on and how they are treating themselves. So these insurance companies are really starting to demand this documentation. And even some of the insurance companies are coming out with their own portals, like many of the manufacturers did previously. And some of you may have used apps like MicroHealth to track your bleeds and log your prophy doses, and give you reminders as to how to adhere to your prophylactic regimen. Now the insurers are demanding this information, and they are also asking that each time you have an active bleed, that within 24 or 48 hours, that will be reported to the doctor and reported to them within a short window of time. And so I think this is really important, because your hemophilia treatment center and your specialty pharmacies have to rely on your honest and accurate documentation in order to make sure you don't have a lapse in coverage. One of the big topics in the community has been about vein health. And in order to make sure that you keep your veins healthy, you need to make sure you're hydrated. Many people need to get hydrated before they stick their veins and access any type of factor product, because if you're trying to stick a vein that isn't well hydrated and you haven't done exercises or you aren't eating properly, they'll just lie and fall flat, and then you experience complications with it. Also, for those of us that are older, you have used the same Old Faithful for so many years, and that vein gets used over and over and over again. And that callus and that scar tissue builds up in a way to where it doesn't hurt, but you don't always get the blood return that you need, and maybe you infiltrate the vein or below the vein. So rotating your veins will help protect them. Also, using sterile materials and spaces. There's also some vein finder tools that you can access these days, and that might help some of you. And applying pressure for 2 to 3 minutes after your infusion in order to reduce bleeding and bruising. So documenting your infusion site is also a great way on your bleed logs to note, you stuck in your left antecubital today, and tomorrow you're going to stick in or day after tomorrow, you're going to stick in your right hand. And so that way you can rotate those veins and maintain vein health at a better rate.
Lee, just
Yes.
some quick questions here. Do you happen to have a list of or recommend any of those? I'm guessing those are apps that are available for the vein finders.
If you go to the app stores, there are several different vein finders that are beneficial.
That's awesome.
I have used
it's a Surface one. It's like a
on
super bright.
on the iPhone. I know they have vein camera that I've used.
Wise, like, hey, there's my vein, but like needle in it wise.
I'm sorry, what?
I don't know.
I'm sorry, I think we have some chatter. I don't know if they're looking to include some information to this conversation or if they just came off of mute accidentally.
Okay. So Vein Camera is an app that I've used before, and it's available on the iPhone. I'm not sure about on Android, but I do know that since I downloaded this one particular program, that there are some better ones out there. And I've talked to a couple of clinicians about their recommendations. I do not have a list of them now, but I can come up with a few and get them to you, Porter or Jonathan, to make available if you'd like.
That would be great, Lee. Also to our community, if there's anybody out there that uses anything like that or has anything that they use to track their dosing or anything like that, feel free to go ahead and put that in the chat for others to see as well. I definitely want to agree with you there, Lee, as far as tracking your infusion sites. That is actually something that I have done since I started Prophy. Is I actually on my my tracker, it has an option for notes, and I actually write down where I hit, how many times it took me to hit it. Sometimes, most times I can get it first time, but sometimes I have to move it around. So that is definitely something important to do as far as for vein health, is to keep track of your infusion sites as well. So thank you, Lee, for pointing that out.
Definitely. It's so critical that we really start to do that from the bleed logs and the lot numbers, expiration date, and the infusion sites, because it's really going to help us in the end. And when we're talking about mental health, by doing this, it sounds really silly, but taking the steps to do these things will help with your mental health, because you're being proactive about something. So you're being proactive about Prophy and your compliance, which really will help you and your family.
Excellent. Looks like we've got a comment here from Nick. He uses MicroHealth, which is an app.
Yep.
I too also use that app. It's really great. It allows, one of the great things that I like about it is it sets up reminders. So it'll remind you of when you need to take your dosing. So if you have a certain schedule, it helps you with that. It also helps you to track, at least on my boxes, there's a QR code. So you can actually just scan that with your camera, and it will automatically input the dosage size as well as the dose, lot number and whatnot on there. So that's very helpful as well. Looks like there's a couple of other people who use that one as well. Nandini uses it. So that's a great one. Again, that's Micro Health.
I
Can be
think that
found
is a
on the
really,
App Store.
that's a really, really great app, and it's really
It is.
comprehensive. It's easy to use. It's easy to assign individuals that can see your infusion logs. So you can assign, you know, your mom or your brother or your wife or your sister or your spouse, or, you know,
Or even your
specialty
care,
pharmacy and your doctors. That
yes.
way, each time you infuse, you can set up a protocol to where each time you have an active bleed, your clinical providers will actually get a notification, or maybe it's every 30 days or every 90 days, but you can set it up and customize it for what is right for you and what's right for your own care team, which I love.
Right.
But in
And I
addition
actually
to
had
that,
to
there are
speak to that,
many.
Lee. I actually had an experience with that where my provider was not on there or not registered with Micro Health, and Micro Health actually reached out to me within 24 hours of me signing up for this to get my authorization to reach out to my provider to ask them to get registered with them so that they can see my logs. So they were very proactive in helping to get that set up if for any chance your provider is not currently set up with them.
Mark and Miguel founded that protocol for Micro Health, and they were really great at reaching out to those clinicians, like you said.
And then
Let's
Lee,
go
really
on with the
quick, we just had
presentation so we
another
can
quick
get to
question on
the
here. What was the vein finder app that you had mentioned? Somebody had asked that again.
It is called Vein Camera. It's what I've used, but take a look. There are others out there. Let's go on with the presentation so we can get to those trivia questions to win those prizes. I believe one of the most important things and most important rite of passage for anyone with a bleeding disorder is learning how to infuse or inject yourself. There's a lot of fear, there's a lot of hype, there's a lot of anticipation, but when you actually learn to infuse yourself or inject yourself, that's a rite of passage to where it gives you that autonomy to live life actively. I've created camp programs and worked with many camp directors across the US and around the country. And those guys at the infirmary and those leaders within the camp setting are so skilled at helping young patients find their way and the path that they need to go on in order to get comfortable with their disease, understand their disorder, and navigate those clinical paths of excellence in order to live an active, healthy life for themselves. I love these things like Big Stick Awards and just the games that would be played, you know, utilizing the analogy of a train to talk about the clotting factors and utilizing the idea that the railroad tracks would represent platelets. But if you remove any one of those train cars, the entire train is not going to get to where you need. And I think it's just fascinating because we use these tools to empower youth and adolescents and teach them about their bleeding disorder and help them get comfortable to lead an active life. These are some of my clinicians. And I love my nurse coordinator and my physical therapist because I can have intimate conversations about anything in my life with them. And I can tell them about my adventures, my travel, my activities in my life, and they've really helped me. My physical therapist, I called her when I was flying back from Texas one day and I was having an iliopsoas bleed and I was in such excruciating pain and I did not know if I was going to be able to make it home or not. and I did not want to get trapped where I was. I wanted to get to my home treatment center. And my physical therapist walked me through things that I needed to do in order to get me back home safely. And I am eternally grateful for that. But those are the types of things that are outside of the realm that you would normally think about, of where our clinicians can really help us and empower us. But if you ever have a questionable bleed, make sure you notify your hemophilia treatment center or your clinical providers, because they need to know about this and help you treat you the way you deserve, okay? So in closing and kind of wrapping up on the presentation part, we talked about the timeline, we've talked about indications of factor and the importance of having a prophylactic indication. We talked about aloctate and alprolix being the first long-acting factors with a prophy indication. We talked about youth and adolescents and about that mental health that affects men and women when you're adherent to prophylaxis. And I didn't cover or talk about a PI in the presentation today, but the product insert that is in your factor box or in your medication box, that is one of the most powerful tools that you can carry with you if you ever have to go to the ER, because the ERs don't always know about your bleeding disorder. But if you have that product insert and you talk to them about the dosage that your doctor has recommended for you, and you're able to point to it in that product insert, it really carries some weight from a clinical standpoint. We also talked about the importance of compliance and adherence and these new regulations and changes with amongst the insurance companies for documentation. And we talked about vein health and how prophy can really increase your physical and mental health and well-being. And we discussed infusions, rites and passages in camp. Any questions as we kind of close that part out and we go into the last few minutes for our Pros of Prophy trivia game?
No questions in the chat. So I think we're good to move along.
Okay, we'll try to expedite this. I see we're short on time, but I want to get through these questions. We've got 10 of them. So this slide goes over the prizes available. The top 2 people from this will win a $50 Amazon gift card. And go to the Drug Co landing page to make sure that you get all that information in there. So the first question, let's set our timer. We'll give it 20 seconds on the clock to put in the chat there, which year, what was the year the word hemophilia was first published to describe a hereditary bleeding disorder? A, 1902, B, 1776, C, 1828, or D, none of the above? And we'll start the 20 seconds now. So everybody go in that chat and write your answer. A, 1902, B, 1776, C, 1828, or D, none of the above? Okay, we'll stop it. And the answer is C, 1828. Hoff did a publication in Zurich, Switzerland, talking about hereditary bleeding disorder called hemophilia.
Okay, and then Lee, just to clarify, did you want everyone who got that answer correct to be listed, or just the first person?
Let's get everybody, but the first person that's noted on there, we'll rank it in that hierarchy, okay?
Okay. So the first person that got that correct looks like was Jessica.
Okay. Number 2, why is hemophilia called the royal disease? A, because Queen Victoria passed along the hemophilia A gene to members of the royal family throughout Europe. B, because Queen Victoria passed along the hemophilia B gene to members of her royal family throughout Europe. Or C, because the Royal Dalton English Ceramic Company passed hemophilia along to the members of the founding family. Or D, none of the above. We'll start our timer now. Okay. And the answer is B, because Queen Victoria passed along the hemophilia B gene to members of her royal family.
Okay, so the answer is B as in Bravo. And so the first one to answer that correctly would be Amy Moon. So number 2 is Amy Moon.
Number 3, 1964, what physician discovered the factor VIII was the substance in a thawed bag of plasma leading to large-scale manufacturing of factor VIII? I see I have a type error. I typed 19 before 1964, but in 1964, what physician discovered the factor VIII was the substance in the thawed bag of plasma leading to large-scale manufacturing of factor VIII? Was it A, Dr. Anthony Fauci, B, Dr. Joycelyn Elders, C, Dr. Stephen Pipe, or D, Dr. Judith Graham Poole? And we'll stop. It is D, Dr. Judith Graham Poole.
So for number 3, the first one to answer correctly was Amy Moon.
Okay. The next question we have is hemophilia B became known as Christmas disease because A, Dr. Stephen Christmas discovered hemophilia B factor IX deficiency, or B, the factor IX hemophilia B gene was discovered on Christmas Day, or C, Stephen Christmas was the first hemophilia B factor IX deficiency patient diagnosed, or D, the researchers at St. Christmas Hospital discovered and diagnosed hemophilia B factor IX deficiency for the first time in 1952. Let's start that now. All right. And the answer is Stephen Christmas was the first hemophilia B factor IX deficiency patient ever diagnosed. The answer was C.
All right, C is in Charlie. So the first one to answer that correctly was Nick McRae.
Next question, what is the most important rite of passage for a person with a bleeding disorder? A, learning to be autonomous and how to administer, infuse, and inject medication or clotting factor replacement. B, learning to make up his or her bed. C, learning to speak more than one language. Or D, none of the above.
Oh, this is fantastic. Unanimously, it is answer A. First one is Nick McRae.
All right, sounds good. Let's expedite this a little bit for you guys. I've just got a couple of more questions. What year did physicians in the United States start to promote and recommend Prophy? Was it A, 1970, B, 1995, C, 2004, or D, none of the above? Okay, do we have everybody's answers in? That was B, 1995 was the year the physicians in the US started to promote and recommend Prophy.
So B as in boy.
Yes.
The first one on that would be Lori Kersetter.
Number 7, why does Prophy fail for patients? A, the patient is taking the incorrect dose because of miscalculation due to weight gain or weight loss. B, patients don't have honest conversations with their hematologist and other clinicians supporting them. C, patients are not taking Prophy as prescribed by their physician. Or D, all of the above. Okay, do we have all answers in?
I believe, yeah.
All right, the answer to that is D, all of the above.
Excellent. So with that, we have Jessica Voshel.
Okay, great job. We've got 2 more questions. What are the best ways to improve vein health? A, drink water and stay hydrated. B, stay active and exercise. C, rotate injection and infusion sites. Or D, all of the above. All right, we're almost there. We're almost out of time.
All right, Lori Kersetter. Kersetter.
D, all of the above. And number 9, what documentation is required for insurance companies, or what documentation are insurance companies starting to require, I should say? A, an EOB from each patient per bleed. B, Prophy, PRN, bleed and infusion injection logs. C, factor peak and trough levels. Or D, all of the above.
Almost unanimous on that one.
Okay.
We're looking at D,
Got-
all of the above.
Actually, it's B. It's Prophy,
Oh,
PRN, bleed, and infusion logs.
B is in Bravo, so that would be Amy Moon.
Okay. All of those other tests and all of those other things, that your EOB is sent to you from your insurance company, so you'll know what is being paid out. The other documentation, the peak and trough, it's not required by the insurance company, but a lot of clinicians are utilizing it, and some of them are getting underway with asking for it, but it's not required yet. And the last question that we have in our trivia game is, what is the month of May? A, Hemophilia Awareness Month. B, National Adopt a Pet Month. C, Mental Health Awareness Month. Or D, none of the above. All right.
So the answer to 10 is C as in Charlie, National Mental Health Awareness. And that would be Amy Moon.
All right. Great. Everybody that participated, I really appreciate your time today. I know we're out of time. If you have any questions, please feel free to reach out to me at Drug Co. Come by our Drug Co. exhibit booth. Make sure you register there, because those of you that played trivia, the only way you're going to get those gift cards if you won, or if you go in and fill out the information on our landing page. And thank you for your time today. I'm sorry I ran over, but I really appreciate your attentiveness and your participation. Thank you.
Thank you so much, Lee. Appreciate that. Everybody, thank you so much for your participation this afternoon in this session. Going to go ahead and close things up here. Again, the winners for the trivia will be announced on the exhibitors website or webpage tomorrow.
Yes.
So please check that out tomorrow, and then get ready for our next session, which is going to be a lot of fun. We're going to get into tying like balloon animals. So it's going to be great.
Great. Thanks, guys. I appreciate your attending the meeting today. Have a safe trip or safe time at the conference, and enjoy.
Thank you, Lee.
Thank you, Lee.
Thank you.
Good job, Lee.
Thank you, guys.